Hi, I'm Dr. Christopher Semino, Vice President and Chief Medical Officer at Kaplan Test Prep Medical. There's been a couple of announcements recently that are important for international medical graduates to know about applying for the 2022 National Residency Match. On February 16th, ECFMG made an announcement about a sixth pathway for getting certified for your clinical skills as part of your ECFMG certification. They will start accepting applications for pathways 1 through 5 in April and pathway 6 in July for the 2022 National Residency Match. Just 3 weeks before that, USMLE made an announcement about Step 2 CS that it would not be relaunched. And USMLE has been making multiple announcements about Step 1 becoming pass-fail. There has been no set deadline confirmed for when Step 1 will become pass-fail. They've only said not before January 2022. However, as we get closer to that date and because of other signs, it seems likely that it will happen in January 2022. If you've already passed Step 2 CS, or you've already been certified by ECFMG, or you applied for and were approved for one of the pathways for the 2021 match season, then you're good. You don't need to do anything further. In fact, they won't let you apply for any more pathways. On the other hand, if you're applying for the 2022 match season and those things don't apply, then you must also be eligible for ECFMG certification. In other words, all those other requirements in addition to CS have to be possible. You could not have been barred from a USMLE STEP exam anytime after August 1st, 2020. And you must have applied and registered for or taken a USMLE STEP component sometime after January 1st of 2018. Finally, you also have to have a satisfactory score on the occupational English test in medicine. Regarding the pathways, if you've ever failed USMLE Step 2 CS, then you can only apply for Pathway 6. You can only apply for the first pathway that you're eligible for. In other words, if you're eligible for Pathways 1 and 2, then you have to apply to Pathway 1. If your school makes you eligible for Pathways 3, 4, or 5, then you have to apply to Pathway 3, and so on. The 2021 requirements, which are still posted, have specific information that goes into more detail and includes cutoff dates. That information is not linked to the 2022 requirements, but we think this is an oversight and that they will almost certainly apply for the 2022 match season as well. Pathways 1 through 5 are essentially unchanged. First of all, you might be licensed as a practicing physician in another country. You must have had your license granted on or after January 1st of 2015. You do not need to be currently licensed, but if you no longer have your license, it cannot be due to misconduct. You may have already passed a standardized clinical skills exam that's part of a medical licensure exam. You must have done so on or after January 1st of 2018. Those exams exist in countries like the United Kingdom, Ireland, Canada, Australia, New Zealand, and several more. Pathways 3 through 5 are that your medical school certifies your clinical skills. You must have graduated on or after January 1st of 2018, and the medical schools must meet one of the 3 requirements. Either they must be recognized by the World Federation of Medical Education, they must be participants in the U.S. Federal Student Loan Program, or they must be a U.S. dual degree granting program. All of these have much more details, and I've included the 2021 links for the details that exist. We expect those same details will apply for 2022 match season. As I said before, if you've ever failed Step 2 CS, then you must apply through Pathway 6. And so far, the only information we have is that it will be an evaluation by a licensed physician using ECFMG's Mini Clinical Evaluation Exercise, or Mini CEX. There is no information available on the mini CEX form on the ECFMG website right now. However, it's likely very similar to the American Board of Internal Medicine CEX exam. And if you Google mini CEX, you'll find that link and see that form. It's fairly short. It's open to a lot of interpretation by the evaluator. For that reason, we expect there will be some additional requirements or qualifications that we're waiting for announcements about. Likely, there will be some restriction on who can complete the evaluation so that there's no favoritism or bias involved in the evaluation. It's also possible they'll require multiple evaluations to be submitted, partly to arrive at an average score evaluation, but also partly to minimize the chance of favoritism and unfair advantage. So taking all this information, the three most important recommendations we make are, first of all, for USMLE Step 1, if you have the opportunity to take the scored exam and do reasonably well, say average even, then you should do so, as a scored exam will help distinguish you from students who only have a pass result. If you want practice with your clinical skills, you should try to find a licensed physician who can evaluate you using the mini CEX form. And finally, you should look at the schedule of dates that the Occupational English Test, the OET test, is available so that you don't miss a window for taking that test and getting a score in order to apply for ECFMG certification in time to participate in the application and match season. With all of that said, I wish you luck in your applications, your interviews, and the match. Good luck.